Great. So we're going to get started. Thank you everyone for joining us over this lunch hour during Nursing Week, and I want to wish you all a very happy Nursing Week. I'm Julie Caldflesh. I work with WeRPN, and I'm happy to be hosting this session about nursing perspectives in harm reduction. Before I get to our guest and do an introduction of Caitlin, I want to do a quick land acknowledgement. I live and work in Waterloo, so I'll talk about the territory that I live in. So I live and work in Waterloo region on the territory of the Neutral, Anishinaabe, and Haudenosaunee people on the Haldeman Tract, land promised to the Six Nations along the Grand River. This is a dish with one spoon territory, reminding us to share and care for the land in peace. I'm grateful for the enduring presence, knowledge, and contributions of Indigenous peoples in shaping our community. And I would encourage you to reflect on the land that you are currently joining us from. I know that we probably have people joining us from across Ontario. And I really appreciate you being here today. Please join me in welcoming Caitlin Craig. Caitlin is a registered practical nurse whose work really truly embodies the theme of compassionate client-centered care. Caitlin graduated from Georgian College in 2009 and began her career in complex care and palliative nursing. Over time, her deep passion for mental health and supporting underserved communities led her into harm reduction nursing. For the past 2 years, she has supervised safe consumption services within an adult male shelter system, providing not only medical care, like wound care and minor interventions, but also supportive counseling and critical connections to the broader healthcare system. Caitlin's work is grounded in dignity, trust, and safety for people who use substances. And we're so lucky to have Caitlin here today with us to share her insights and experiences. We're going to take the format of doing a Q&A with Caitlin just to get the ball rolling. And from there, if you have questions in the audience, if you could use the Q&A button to put your question in there, we'll get to those probably about halfway through our time with you today. So Caitlin, welcome. How are you doing? I know you're also in Waterloo region, so sunny day here today. I'll get started really by diving in and asking you to share a little bit about your journey into nursing and what led you specifically to harm reduction.
So as you briefly touched on before, I graduated Georgian College back in 2009, and I jumped right into, it's like a complex care unit with a lot of trachs, a lot of bedside needs, and it was split with a palliative unit. And walking into palliative nursing was quite overwhelming, I would say, as a new grad student. But it gave me a real good compassion for like living every day in the moment, I would say. From that, I got into psychiatry for a good decade. I worked at Homewood Mental Health for a good 12 years. And through the pandemic, I'd say as well too. That's where I really started to get a little bit burnt out from the acuity of the fast turnover rate of psychiatry. It was a bit, the in and out was treated more of a factory type of nursing, and I kind of really missed the bedside manner that was in the palliative side of nursing. I was watching over Sanguine as a like a community nursing outreach Hep C team. It just kind of took me a little while to get past my imposter syndrome to apply, but I did, and I'm so thankful that I did, because it's been such a just a big change, I would say, from the clientele that I'm served now. They're just so much more appreciative, and you can really get into details of your life and just sharing those moments. Yeah.
Can you talk a little bit about Sanguine and what Sanguine does in the community?
Yeah, so we like provide harm reduction nursing and street outreach. Me specifically, I'm housed at a male shelter system, so I only go out into the community when there's events. I would say that they want like a Sanguine employee out there just to like answer questions for the community and kind of be like that hotspot for providing resources.
Great. Um, so for those who maybe aren't familiar but are curious, how would you define harm reduction, especially in nursing? And what does it look like for you day to day in your role at Sanguine?
It's just kind of like meeting people where they're at, observing a lot of subtle cues, listening to words that are unspoken, and kind of like adjusting your client care to those needs. It's just a different aspect than it was in hospital nursing, where it was like you had a list of things you had to do, you had medications to give. It was very fast tracked. There wasn't a lot of slowdown.
So, as someone who I also work with Sanguine part-time, so that's how I came to ask Caitlin to do this session. And can you talk a bit, Caitlin, about where you do your work? So you're in a shelter, but where do our teams at Sanguine, do their nursing?
Um, well, the outreach teams would do it like at their tent city, at community shelters, just kind of like meeting people wherever they're living. And then in the shelter system, the 100 participants that live in this building have access to the substance use room that I am in.
So what are some of the common misconceptions that you encounter through the work that you do?
A big one would be that we supply the drugs that people want to come here to use, and that is not the case. There is an idea of safe supply, which is a prescription that people would get from an outs like a prescriber, and they could take that to a pharmacy and obtain their legally administrative drugs that way and bring those to our clinic to use. But we don't give out that prescription. That's not something that we initiate. And they would have to be on a program for that. So there's monitoring, there's urine samples, there's contracts that are signed, stuff like that too. Another common misconception would be that the amount of drug use is increased because we're providing a space to use, and that's been the complete opposite with the shelter system here. We've had a lot of instances where people were using in their room and having overdoses. So providing a space in the shelter that the clients can go to and be monitored and using less interventions than just the naloxone, it kind of creates a safe space for them to come and do that here. And then there's less likeliness of them overdosing in their rooms. So, yeah.
Great. Um, so what does a typical day look like for you in your work with Sanguine?
Yeah. So just coming in and checking, doing like a verbal handover with the team previous, just to see if there's any hotspots and clients that need care immediately. From there, I'd check my emails just to follow up because there's a shelter care nurse position that works with me, Jenny, who was previous in my team as well. But we've kind of split up to tackle all the clients too, because not all the clients want to come into the substance use room for medical needs. So we're kind of helping each other out that way. And then just observing clients' use with their drugs, providing them examples of best practice, if they're willing and open to hear it. Not all the time they are. If someone's a seasoned veteran in injecting and they do it a certain way, that's how they want to do it. So just being gentle in that. Yeah, and just keeping the environment clean and providing resources to primary care.
And I think you raise a good point where the care that you provide isn't about judgment or shifting behaviors if they're not ready for that. And you said this earlier, the meeting people where they're at and accepting them. And I know the folks I work with at Sanguine love the people that they support and just being there to do that and not provide judgment to them where they receive that in a lot of other settings. So do you think that people do you find when you talk about what you do, that people assume that we're trying to change that behavior, stop people? Yeah. Do you have any thoughts
It's
on that?
we're so accustomed to that rigid model of like, this is sobriety, this is the 12-step program, we expect you to be completely absent. And it's like, well, relapse is a part of recovery too, right? And people are assessing like they're dealing with the trauma on top of being unhoused. And there's a multitude of things that need to be stable in place before someone can even access those resources too, right? And yeah.
Yeah. So, do you have any moments since you've started working with Sanguine and doing this work that really stick out for you, and something that you'd want to share with this group?
It's like there's so many, I don't know which one to pick. I love having the moments of just coming in and connecting with the clients, of them remembering little details, or just sharing like what we did on the weekend, and then someone remembers that I did something and we have that moment of connection.
And what do you think that does for people? Like, there's again that judgment that goes with the harm reduction work so often. Having those connections, like, how is that healthcare?
It just builds that rapport. Like as someone, as we're building that connection back and forth, they're more likely to accept the services to the road of sobriety if they choose to.
Right. So, what are some of the biggest challenges that you face as a harm reduction nurse, and how do you navigate those?
The biggest one would be losing clients and dealing with the grief. Um, Taking personal days when I need to, and just kind of like being in community here, because it's not only a loss to myself, but it's a loss to the community as well that's here. Um, yeah, and just the lack of understanding from the government, I'd say another ongoing challenge with the closure of the CTSs.
Yeah. Um, yeah, for those who don't maybe follow the news or this type of news as much as maybe you or I do, we have just recently in Kitchener had to close our consumption and treatment services site, due to some changes in legislation and some funding changes. So our agency has been working to try to navigate that, and with this burden of we need to keep these folks alive and they have one less kind of connection. So it's been a scary time for sure.
Mhm.
Um, Harm reduction nursing often requires strong therapeutic relationships. How do you build trust with your clients and who maybe have had a negative experience in the healthcare system?
Well, trust always starts with respect, and creating all-inclusive spaces and trauma-informed approaches to care. I also use a lot of humor, and I'm just willing and open to share appropriate things in my life that clients would be allowed to know. Yeah.
Um, so how has working in harm reduction changed or shaped your understanding of what it means to be a nurse?
It's really moved me away from the clinical black and white practice of diagnosing and treatment, and that there's many paths to sobriety and they look different for everyone. It's also increased my compassion for others and really witnessing folks whom treat their symptoms the best way they know how.
Right. I see that we have a few questions that have come in. Oh, I recognize some names in here. So Kasia is wondering what advice or information would you give nurses who are interested, curious in trying harm reduction as a specialty?
Come out and shadow. Yeah. Come see what
So,
we do. Come take a day and just witness and follow us around and get involved.
and so is that something that you did when you were exploring this as a career?
Yeah.
Yeah. And so how did you do that? Did you just show up at Sanguine's door and say, hey, I'm interested in in doing this?
I started with kit making.
Hmm.
Yeah, just volunteer work, reaching out where they needed help that way and expressing interest in being employed there. It was pretty much immediate that I was welcomed and invited.
And just for context, kit making at Sanguine, we have kit making groups throughout the week where we bring in volunteers from the communities we serve. And it's often the access point for volunteers into our agency. It's kind of it's a nice introduction, and it's a great way to start learning about these types of agencies like Sanguine and getting involved. We have another question. So what would you suggest for a new grad looking to start a career in harm reduction? So getting out there and finding agencies in their community and volunteering.
Mhm.
Um, okay, Ashley Fox. I'm so excited to see Sanguine has been working to support our rural communities outside of the urban area. Are there
Mhm.
specific challenges that come with providing care in the urban and rural communities? For example, lack of shelter options,
Mhm.
um, as one of the things that you might see out there.
Yeah, I guess we would have mobile units that go out to smaller locations.
So we have, yeah, that's right. We have a unit that goes out in the Wellington County areas. So Ashley, I think that's where you would be seeing our folks come in, as well as in the rural, in the townships within Waterloo region. Um, and our mobile unit does have a nurse, on the unit. I think that you get into these areas where there can be a service desert where you just don't have a lot of things to connect folks to. And I don't know, Caitlin, if you agree with
Mhm.
that, but I've certainly heard that from the teams where there's times when, we're the only thing coming to them. And then you're
Mhm.
absolutely right. Shelter systems tend to be more centered within larger cities and urban areas. So um, again, people don't understand that someone who is unhoused still wants to stay within their community. And so offering them a shelter bed, you know, 15 miles away from where they live is not always an option for folks who, maybe they have children that they're still, caring for and visiting, but they're staying with a relative. So there's lots of
Mhm.
reasons why folks want to stay close to where they live, where their people are, just like the rest of us. So I don't know if there's other things, Ashley, that we see rurally. I know you're not out on that unit, but these are some of the things that I've certainly heard.
I
Yeah.
think most of the resources rurally would be connected to whatever local hospital, right? Like if it was up in Palmerston, probably Mount Forest might have been the biggest hub. And then further would be like Owen Sound.
Yeah. Yeah. And that feels far for folks.
Yeah.
Um, so we have a question from JP, wanting to know, based on on your conversations with folks, what's the one thing that your clients wish the public knew about them?
But they don't choose to be someone who uses drugs. Oftentimes they don't want to be addicted.
Mhm. What do you think some of the things, or what do you hear from your clients when you're having those conversations? What are some of the reasons that have led to this?
Trauma, dealing
Yeah.
with being unhoused, having to stay awake so that people don't steal your belongings, even in shelter systems. Because as soon as you fall asleep, you're a victim.
I remember hearing one of our outreach workers talk about the extreme cold. And we know in Waterloo region, we have about 2,300 folks who are identified as unhoused right now. And we just came through a brutal winter. And
Mhm.
yeah, like this becomes an option for folks who are freezing, and we don't have
Mhm.
proper shelter for them as well. So yeah, I think people are surprised to hear sometimes that homelessness often causes drug use, not the other way around. Yeah.
Yep.
Can you tell us more about the mobile unit? How does it support those who are struggling with addiction? So if you want to start, Caitlin, and if I can support, I'll jump in too.
Yeah, I believe the mobile unit goes out to 3 different locations, twice to 3 times a week. I'm not sure specifically on their schedule, but the idea of that is that there's specific places they go to every week so that people know, like Tuesday we go to this motel, Wednesday we go to this hotspot. Ray of Hope, I think, is another hotspot that they drop by. Um, yeah, and then they would get referrals to inpatient if they needed that, or they could come to the headquarters as well and meet with Dr. Steingard if that was necessary.
Yeah, we have at Sanguine, we have a mobile clinic essentially that goes out with a nurse practitioner and a whole nurse team to those locations that Caitlin identified and provides testing and healthcare. We are a hepatitis C clinic, so a lot of testing treatment options can be offered through it's a clinic on wheels. And then we have an outreach van that goes out into places like encampments. Um, we have a schedule and locations that folks can meet us at in various parts of the community throughout the week, Monday to Thursday. And people just know where and when the Sanguine van will be showing up. And we have a nurse on that van typically as well. And so it's like you were saying earlier, Caitlin, it's roadside, it's in fields, it's in parking lots where we're, Sanguine, and I know other agencies and other communities that many of you are listening in from are providing this connection to folks, and that's through harm reduction, supplies and clothing, conversations. Like Caitlin said, she just remembers what people told her and picks up the conversation next time. That means a lot to folks who, generally have been erased from community. So, those are the kinds of things that we do at Sanguine, but there's certainly other agencies doing different things, but really it's about bringing healthcare to people in the community. And I don't know, maybe if there's more questions, but we can also talk a little bit about drug checking if anyone's interested in that. So another question, can you tell us more about, oh, no, just answer that one. How can nurses and or the general public support those who are unhoused or struggling with addiction?
It's tough, I feel. Donating money and time, mostly time, I would say more than money. The resources are nice, but we're also funded by the region, so we do have supplies that way. Tent City, I think, would be the one that needed more physical supplies than the group homes and the shelter systems. Yeah, because oftentimes when you're roughing it, they'll come by and just clear house all your tent, all your food that you had packed, everything that you had on the side for later is gone. So they have to restart every time.
I think that, again, you've raised a really good point. There's a lot of people just don't realize what's happening in this community. And how you can help is by learning more as well, and understanding that homelessness is a complex issue that leads to a lot of other issues for folks, and we need people to advocate and understand that there's not enough support, and we're trying to do our best, but it feels like, Caitlin, I mean, I'm not on the front line like you are, but it feels like we don't have enough hands to do this, and the problem is getting worse. People are getting sicker They're outside longer. They're experiencing homelessness for longer. So I think really understanding what the landscape looks like in your community, and homelessness is and housing is a provincial issue, but we often say at Sanguine it needs to be managed at all three levels of government. So engaging with your government. We're having a session tonight about nurses engaging politically. It's certainly important to have your voice in those conversations. Yeah, and just helping people to know that, uh, like Caitlin was saying earlier, like that these are humans and they didn't want to be in this situation, and they deserve the care and compassion that everyone deserves, all of us deserve. Um, can you tell I do communications for Sanguine? Locked and loaded. So, nursing in our current healthcare climate can be really challenging mentally and physically. What are some of the things, Caitlin, that you recommend doing to stay well while doing such challenging and incredibly important work?
I do a lot of debriefing with my coworkers when there's situations that arise, whether it's grief or if people are moving through different big feelings, because we all have feelings, right? We all have things we process and regulate. Um, yeah, having that team approach is super important, having those connections here at work. And then just really like learning how to fill my own cup in my own time, right? So my hobbies, my interests, my extracurriculars. I'm recently got into foster dogs and I do that on the side now, and just having a companion is helpful. Yeah.
Now I wish I would have known that, because I would have asked you to bring the dog to the session.
Oh. Yeah.
That's great. And for those of you who are looking at doing other sessions this week with WeRPN for Nursing Week, we do have on Thursday a couple of sessions focused on self-care, because it's very vitally important, especially in the climate that you're all working in, to find ways to look after yourself. So how do we get involved? You mentioned kits. So if you live in the Waterloo region, Wellington area, and you want to get involved with Sanguine, which is the agency that Caitlin works at, you can go to sanguine.com. Sanguine is spelled SANGEUN.com. And I can throw that into the chat as well. And reach out, info@sanguine.com. You can email us as well, and we'll get you connected with our volunteer coordinator to come out and make kits. And we're always looking for people to help, so that's great. Okay, so you mentioned the term roughing it and how people are left with nothing and have to get supplies all over again. Can you explain this a little more? I'm not familiar with the concept.
Yeah, so roughing it would be that someone is living full time in a house, or sorry, in a tent as a house, and say that day they decided they had enough money, they wanted to go find some food or some medication to help with their symptoms. They leave their tent behind, maybe a couple valuables in it, but they carry most of their things on their person. So you go out, you do your errands for the day, you come back, and your entire belongings are gone. Like somebody has just come by and taken it or stolen or thrown it in the garbage, whether it was a part of Tent City, beside Tent City, in a forest somewhere. It's just, you don't have anything to come back to and feel settled and to feel safe in.
And we are seeing that happen more and more as homelessness grows in communities. There's a lot more of these mass encampment clearings, but you're right. Also, those just smaller, like it can happen because someone's having a beef with someone else, or, a community member. We do see sometimes community members will come in and destroy stuff because they're frustrated. They're frustrated too with the fact that there's encampments in their community. And, we understand that, but it really isn't the folks that are living in the tents that we should be angry with. We need to direct that in the right way. Fires happen too. That can be another thing, especially in the
Destroying.
winter. Um, where can people refer to gather more information about mobile clinics?
Sanguine website.
Yeah, so
Is there a
if you're in the
general?
Waterloo, Wellington area, so I would say if you're interested in harm reduction work in your community, um, you can likely find an agency like Sanguine within your own community. Um, there's lots of us out there trying to do this work. So I would check with, like, do a Google search in your community for harm reduction services. And not everyone is fortunate to have mobile clinics, but a lot of them are moving in that direction because it's just so helpful.
And I
Um,
think a lot of them are tagged as like community outreach. Like I might not say shelter or like harm reduction. I might just say like outreach nursing.
True. So we have a question from Annette. Can you share more information about the organization, the staffing model? How many NPs? How many RPNs, RNs? Are there physicians, social workers? Who wants to take this this one, Caitlin?
um, yeah, I guess from the very top, it would be Dr. Steingart that created this business, and then below him, his wife Michelle, who does a lot of the bookkeeping and organizing. Um, and then we just had things move around a little bit. So is it Lindsay and Anne as our directors?
And me, yep.
Yeah,
And so yeah, so there, and then under would be the clinical teams,
and
which
then
you
yeah,
would be in charge of.
the smaller teams under that. So it's compiled of different people all around. I'd say like RPNs, RNs, nurse practitioner, prescribers, one or two doctors.
And
Yeah.
then Dr. Steingart, who is the founder, along with his wife Michelle, I believe back in 2007 they started Sanguine. He left Grand River Hospital, was a infectious disease doctor at Grand River Hospital, started seeing a real increase in the number of folks who were living rough, also having hepatitis C, and knowing as an infectious disease doctor that that's highly preventable, wanting to get into more harm reduction and prevention. And that's how Sanguine was born. But as Caitlin's done a good job of describing, the work that our harm reduction teams do has a lot to do with building relationships. And so you can't just go out into community and say, we're here to treat you and test you for hepatitis C. It starts with offering a hot chocolate and a granola bar and having a
Mhm.
conversation and showing up for them over and over again. And eventually our nursing teams get to a point where um, they're able to do those types of tests. I know that on our clinical team, we have a number of different types of nurses. So we have a couple of nurse practitioners, we have RNs, and then we have RPNs like Caitlin. I know Phoenix as well. So we have a whole mix. We also do have social workers and social support team. And we work with a lot of other agencies in the community, including there's a physicians group that Dr. Steingart is a part of. And we do have physicians that work within the agency, not full time, but they do see clients throughout the year. And some will go out. I know Dr. Maria, for example, goes out on the van. So um, yeah. So let's see what other, those were some great questions. Um, so what do you want other nurses, Caitlin, and other healthcare professionals to understand about the role of harm reduction in healthcare? So whether it's where you are, which it seems very obvious and needed, but in any healthcare setting.
It's hard. Just to meet people where they at is so important. Because there's so many things that we can we can just get under all the good juicy details, but you have to build that relationship first because you can't expect to rip off the band-aid and to heal that quickly.
So what fuels your passion looking ahead? It's a difficult time in this province right now for harm reduction workers. So what keeps you motivated and moving ahead?
Just the clients, I would say, coming in and building those relationships kind of makes it fun to be here at work. Sometimes we just goof around and play games and yeah, watch music videos together. We like put on their favorite music and yeah, just story times.
With normal human stuff.
Yeah, just hanging out.
I think a lot of people are surprised to know that a lot of it's just super normal, stuff and just having conversations. And there's so many interesting people that cross paths in the work with us in the work that we do. And like I said, I'm not a frontline worker when I work with Sanguine, but I do sometimes go out with the van team, or I've had that opportunity. And yeah, it's a normal night. People who don't do that work don't understand that. And they're like, oh, what was it like? And you know, it's great. Saw this person, had this conversation. Um, yeah, it's
And
just
it's such an honor to be able to help someone inject and to have that intimate moment of helping them use their substance in a way that's best practice is just it's helpful, yeah, to know that they're doing it right.
so I'm at the end of my questions, and we had some great questions from the audience as well. I'll do a last call for questions and then we may be on to prizes. So don't log off yet because there are prizes. Any other questions? Going once, going twice. Well, I want to thank you so much, Caitlin, for coming and talking to us today and kind of opening that conversation about this perspective on nursing and harm reduction work. And I have seen a lot of comments about how much people appreciate what you do, and I hope you get a chance to kind of scroll through them. A lot of appreciation for this type of work, which I think is really important to see and hear, especially on those harder days. So thank you so much, Caitlin, and so lucky to have your time today just to learn a little bit more about harm reduction. And for those of you who are interested in learning more, you certainly can reach out. I provided the information for Caitlin's agency. I'm also happy to take questions. I'm jcodflesh at WeRPN.com. If you want to reach me through WeRPN. It's confusing. I have two jobs. I'm maybe too busy, but I enjoy working with nurses, and I get to work with harm reduction team as well, which is really fortunate for me.